Hi there, Dr. Todd Cameron here, GP and Medical Director at M3 Health. The reason you're seeing this video is you've asked for further information on COVID-19 or your GP has determined that you would benefit from that. In the message that came with the link to this video, there is also a link to an Australian government document that goes into some of the frequently asked questions in more detail. But what I want to talk to you about now is just a brief summary of exactly what's going on with the COVID pandemic. COVID relates to patients that become infected with the virus which has the name SARS coronavirus 2, and there are some really important things to remember during a pandemic, and you'll have heard this many times, so I'm hopefully repeating what you already know. The most important advice is stay home. We need to prevent people circulating because if people are moving around, they're more likely to contact each other, and this virus is very contagious. It is several times more contagious than the flu, and it is probably between 10 and 30 times more fatal than the flu, so we need to take this very seriously. Second point is social distancing. Please keep your distance from each other. 1.5 meters is considered to be the ideal minimum distance. So that's not the maximum, that's the minimum. Further away from that is obviously better, and preferably no contact between people. Wash your hands regularly. So this is really easy. Soap and water is by far the best deterrent. The virus has a fatty layer, which means it is vulnerable to soap. Soap is superior to alcohol hand gel. So the only time to use the hand gel is if you're out and you do not have access to soap and water. If you have soap and water, it's preferable to use that. Remember, you need 20 seconds or more. Get a good lathering of soap, front and back, in between your fingers, top and bottom, making sure that you're washing all of the parts of your hands, and then make sure that you dry them ideally on paper towel. But if you're regularly washing the towel that you're using in your home or elsewhere, then that's also fine. The last thing is the hygiene. If you're using your hands to touch your eyes, nose or mouth, that is where the virus can get entry, because you can pick it up off surfaces if you're touching surfaces. So avoid touching commonly touched surfaces, balustrades, in the train, transport, any surfaces, playgrounds, etc., where lots of people will have touched. It's important not to touch them. Don't touch your eyes, nose or mouth. Obviously with kids this is really hard, so if you have to take your kids somewhere, make sure you do take some alcohol gel just to wash hands. Before and after eating, as you normally would, you should always wash your hands. And remember, coughing and sneezing into the crook of your elbow is the most important thing. If you are unwell, please stay home. Do not go out. Download the document that's associated with the message that you receive from us, and look at following all of the suggestions in there. If you're unwell, book an appointment with your GP, and make sure that you book an appointment with your usual GP. That would be ideal. And the link is also found below this in the message that you receive from our clinic. Hope that's been useful. I've been Todd Cameron. Bye.